My name is Christine Lee. At the age of 33, a clot went through my PFO and up into my brain and was the root cause of a left thalamic stroke, which left me with a 15-minute short-term memory and loss of executive function as well as aphasia.
Christine didn't have any of the typical stroke symptoms, where a person would get weak on one side or lose vision on one side. She did have speech difficulty, and that should have or could have alerted her that she was having a stroke.
He suspected that it was a PFO, given that I'd had a stroke at such a young age.
Typically, we'll do a screening test of the heart called an echocardiogram. But in Christine's case, we had to do one called a transesophageal echocardiogram, where we'll actually look, there'll be a small catheter placed down the throat, so we'll look at the heart from the backside, be able to see the PFO more clearly.
Almost exactly 6 months later, I experienced another TIA. I was admitted, and that's when I met Dr. White, my cardiologist, who recommended closing the hole within 7 days.
I remember her very well. I think she saw her neurologist that was involved in the case, either in the emergency room or at least the next day in the hospital. And he ordered an echo, and then I read the echo and called him up and said, gee, I see an abnormality that we might want to think about closing.
We decided to really take care of that PFO at that point, and the device that went in was the Amplatzer PFO Occluder. It was an amazing amount of confidence. And he was very clear on explaining the procedure, that it would be done in a cath lab. He even gave me the drawings of the PFO occluder. Flash forward to after the PFO, 1 week after the PFO, I was allowed to go on a treadmill, and straight out of the gate, I'm running 5 miles an hour. And I just can't believe it.
It's really important to have a good referral network and know who's good that you send to, and it's important to know that PFO closure is an option.
I have had so many emails from readers who say that their neurologist won't make that referral to an interventional cardiologist. They just won't. They want to know the name of my cardiologist because they're just so desperate.
And now some of the more recent data has suggested that in anybody with a stroke who has a PFO, regardless of whether they're on medical therapy at that point, they should have that PFO closed.
If I didn't have a neurologist who made a referral to an interventional cardiologist, and if I didn't have an interventional cardiologist who was familiar with and had full confidence in PFO closures, then I'm at square one, except I'm mad. So my daughter's 6 years old. I had her when I was in the best shape of my life, when the stroke was well past me. This little device has completely been life-changing for me. And the doctors who recommended it and put it in my body, I'm forever grateful.